One.
Good afternoon. Welcome to a very special edition of P&P Live at Lunch. I'm Heidi Lewis from Politics and Prose Bookstore in Washington, D.C., and I'm excited to welcome you to our health equity panel today, sponsored by AARP. We're going to hear from renowned physician Dr. David Satcher, formerly the director of the Centers for Disease Control and the 16th Surgeon General of the United States, who's also the author of My Quest for Health Equity. We will also hear from health policy expert Daniel E. Dawes, author of The Political Determinants of Health. The authors are joined in conversation by Dr. Erwin J. the Director of Thought Leadership Health at AARP. As part of this special partnership, today you'll be receiving a free book, Compliments of AARP, and their commitment to advancing important dialogue around issues of equity, and to create a future that embraces equity and innovation across the lifespan. However, if you feel moved to buy more copies during this event, I'll provide a link to buy the author's books from Politics and Prose in the chat once our discussion is underway. So the chat will remain open during our event, and I encourage you to use it to deepen your experience of today's panel. I hope you will also pose your questions for the authors in the Q&A box, which they will take after the first half of their discussion. I'd like to formally introduce you to Dr. Erwin Tan, a physician with fellowship training in geriatric medicine and integrative medicine. He's a nationally recognized thought leader on healthy longevity, volunteering, and the health effects of perceptions on aging. Erwin previously served as the director of senior corps at the Corporation for National and Community Service and as facility at the Johns Hopkins School of Medicine. From 2003 to 2004, he was a White House Fellow serving as a special assistant to the Secretary of Veterans Affairs. Erwin was born in Indonesia and is a naturalized citizen of the United States. Thank you all so much for being here today. Thank you to AARP for bringing us this opportunity and to the panelists for their time and participation. To Dr. Tan, welcome. Looks like we're having just a smidge of technical difficulties, as is the norm in our new times.
Hold on. Hold on one sec. Good afternoon. My name is Dr. Erwin Tan, and I am the Director of Thought Leadership Health here at AARP. I'm very excited to host this. One second, I have some technical difficulties here. I apologize for this. I'm honored here to be joined by renowned physician, former U.S. Surgeon General, Dr. David Satcher, and health policy expert, Daniel Dawes. We're here today to discuss their new books on health equity. AARP is excited to sponsor today's event as part of our ongoing commitment to create a future that embraces equity and innovation across the lifespan. We have a long history of working to address racial injustice, disparities, epitomized by how the current efforts to address the impact of inequities in health and wealth throughout the lens of COVID-19. Our thanks to Politics and Prose for our partnership in hosting this important conversation. Dr. Satcher is the founding director and senior advisor of the Satcher Health Institute and professor of the Morehouse School of Medicine. In his new book, My Quest for Health Equity, he takes an inspiring and instructive look at his own 50-year career of shared hard-won lessons in eliminating health disparities. Dr. Dawes serves as Daniel Dawes serves as the director of the Satcher Health Leadership Institute at the Morehouse School of Medicine. In his new book, The Political Determinants of Health, he draws on his firsthand experiences helping to shape major federal policies to address systemic barriers, preventing the U.S. from becoming the healthiest nation in the world. And I welcome you both. Hi, Daniel.
Hi.
And I looking for, I think Dr. Satcher will be joining us. As we wait for Dr. Satcher to join us, let me see. What I can do is, why don't I start with the first question to you?
Sure.
Okay. So I'd like to kick off this question about our nation, what our nation is experiencing right now.
Yes.
Oh, here, do we have, oh, here. Dr. Satcher, good. I would like to kick off today by asking a question about what our nation is experiencing at this moment. Both of you have spent your careers discussing health inequity, and it feels like COVID-19 has put a spotlight on this issue. How do you think we should move forward from here and begin to tackle the disparities we see in how this pandemic is affecting different communities? I'll let either of you answer first.
Well, I'll certainly defer to Dr. Satcher. So Dr. Satcher, would you like to go first?
Well, since you deferred to me, I guess I will. We have been dealing with the issue of disparities in health for some time now. I think it goes back to 1990 when the reduction of disparities in health was first incorporated into the nation's goals and objectives, healthy people. When I was Surgeon General, in 2000, we launched the Objectives for Healthy People 2010. And in that, for the first time, we didn't use the word reduce disparities, but eliminate the disparities in health. And so we're trying to get to the point where this effort is measurable, where it's not something we can just say, well, I agree with that, it sounds good. But we have now developed measurable objectives to go with each one of the goals. And so I think that's very important. And I think, therefore, better defining the barriers to the elimination of disparities in health, whether they be political or social or what have you, is critical. So I think we are moving in the right direction, I guess is what I'm saying.
And I'd like to add to that, Dr. Tan. So, you know, never before in our country have we been able to achieve an equitable response to an epidemic or pandemic. As Dr. Satcher mentioned, you know, from his tenure in public service as Surgeon General and Assistant Secretary, he moved us really boldly to, you know, this notion of eliminating disparities, that they could be eliminated. And I absolutely agree with that. I think, you know, when we look back now and as we've been venturing further upstream to tackle these inequities that have been entrenched in our society, in our communities, and in our institutions and structures, they're not permanent, right? There's something we can do about them. And I think that's exactly right. When you talk about this pandemic that we're going through, it has magnified, it has spotlighted these inequities, right? To a degree that we can no longer ignore it. But when you go back in history and you look at the responses that we've been able to realize during a pandemic, there's never been an equitable response in this country for the people who have been on the downside of advantage and opportunity, the ones who've been most negatively impacted during these pandemics. And I believe that this moment in history is our opportunity to change that and to build upon the work that Dr. Satcher and other incredible leaders have set forth, right? Laying that foundation for us. And so we need to harness that power of collaboration to effect the changes that will help us realize meaningful and impactful and systemic changes moving forward. I think we need to move beyond a piecemeal approach to truly embracing a comprehensive approach to these inequities in our society.
And I like, you know, this to addressing these inequities to potentially achieving that equity. You know, Dr. Satcher, when I read your book, I actually spent about half a year at in Fort McClellan, Alabama, which is at Anniston, where you mentioned,
Yes.
when I was in the United States Army. And you introduced your book talking about your experiences growing up in Alabama, suffering from whooping cough and not being able to go to the nearest hospital because it did not allow Black patients. And how did this illness and growing up in a farm outside of Anniston inform the life journey that you describe in your book?
Well, let me put a name on the table, and that's Dr. Jackson, Dr. Fred Jackson, who was the only Black physician in the Anniston area at the time. And he, on his off day, agreed to come out to the farm to see me. And but Dr. Jackson, he didn't expect me to live, but he didn't stop there. He told them what they could do to give me the best chance of surviving. And based on everything I've heard, my mother went beyond the call of duty, including breathing for me, you know, when I stopped breathing and stuff. So that was sort of a beginning for me. The only hospital in the Anniston area was segregated, and Black physicians were not allowed to admit their patients. So that was sort of how it started, and a lot of people in this country have experienced that kind of thing, I'm sure, but it stayed with me. And I wanted to meet Dr. Jackson, of course. So my parents told me that for my 6th birthday, they were going to take me to town to meet Dr. Jackson. I was excited, but I never met him. He died that year. And so I started saying that I'm going to be a doctor like Dr. Jackson. And the rest is sort of a history of, I don't mean to simplify it. I've had a lot of support and a lot of help along the way.
Thank you. Thank you. You know, that, yeah, no, having been there, it brings a new layer to what I saw. You know, Daniel, in reading your book about the political aspects of healthcare policy, I thought of a previous conversation we had with Wes Moore at AARP about his experience growing up in Baltimore. And I used to be faculty at Johns Hopkins there. A few miles can mean such a difference in health outcomes. Now I look at Washington, D.C., and you compare Cleveland Park with Anacostia, it's almost a 30-year gap in longevity. What are some of the key drivers you write about in your book about these disparities in geography and place?
Yeah, thank you, Dr. Tan, for that question. So, you know, I too, you know, encountered a similar situation, not a 30-year gap in terms of longevity, but a 15-year gap. And I always wondered about that, right? When these maps were starting to come out and the data was available, I said, I want to see where I grew up, you know, which was a lower socioeconomic status community in Fort Lauderdale. And I thought, well, I wonder if that's the case in that area. And absolutely, it was a 15-year you know, difference in terms of life expectancy. But you know, you see this across the board in communities of color all over the United States. And so it really piqued my interest. And when you talk about have demonstrated that racial and ethnic minority groups are disproportionately impacted by disease, right? And as you heard, you know, Dr. Satcher mentioning, this is something that's been with us for more than 400 years. So when we look at health inequities, we understand that there are multiple interacting determinants of health, whether social, environmental, behavioral health, in certain geographic and demographic contexts that are plaguing our society. And we know that they've led to what? Generational and situational poverty. We know that they've led to low standards of living for some, broken educational, criminal, and health systems, to name a few, inadequate transportation and housing. So a lot of these, as we turn now, the social determinants of health. But there is an instigator, right, across all of these determinants that we haven't been paying much attention to, or we've been ignoring it, right, because it's not as palatable as these other determinants. And these are your political determinants of health, your political drivers. Undergirding every single one of these is a political determinant, right? So the way I think about this, as you mentioned Wes Moore and his experiences in Baltimore, if you go to Baltimore, you go to Miami, you go to Atlanta, Mechanicsville, in that area of, in that neighborhood of Atlanta, you go across into the Midwest with Omaha and Detroit, all the way to the West Coast. In every one of these African-American communities, you'll oftentimes see the neighborhood being split in half by a highway, a major highway. You'll oftentimes see in these neighborhoods, and you wonder, how did they get there to begin with? Or you see parking lots where houses and apartments once stood, but they were razed and displaced hundreds of thousands of African Americans across the country. Well, as we have learned from our public health researchers over the years, many African American and other communities of color are breathing in some of the most toxic air, right? They have the highest rates of asthma. And we've been able to link those to these social determinants, these structural conditions in which we're born and in which we live and we worship and so forth. But we have to now ask ourselves, if we want to move beyond merely nibbling around the edges of the problem of health inequities in our country, we have to ask ourselves, how did those structural conditions come to be in the first place? We need to look at these city ordinances, these state and federal legislation, these regulations that have come in and have created that structural condition to begin with. So I would say that those are really some of the main drivers. Beyond the social and environmental, it's an and. We also have to address the political determinants of health, because unless we do so, many Native Americans, African Americans, Latinx Americans, all of these groups, will continue to contend with neighborhoods that are largely devoid of health sustaining and health protective resources. And they'll still contend with these public policies that created, perpetuated, and exacerbated these health inequities.
Yeah, I like in your book how you talk about determinants of the determinants, right?
Yes.
That's a very, very provocative piece. And I think I'd like to build on those conversations as we go on.
Sure.
Turning back to Dr. Satcher, one of the key themes in your book is about developing the next generation of public health leaders. And we saw with the recent passing of John Lewis and the history he imparted upon the future generations, how do we ensure the lessons learned by people like you are past the future leaders in the fields of medicine and public health?
Well, it's interesting that you mentioned John Lewis. I'm sitting here on the campus of the Morehouse School of Medicine, and right across the street, of course, is Morehouse College, where I went to college. And in 1960, I became a part of the student movement. At the time, John was in Nashville at Fisk. I think we may have been a year apart in terms of, enrollment and graduation, but Fisk and Morehouse were always very close institutions, very similar in many ways, except that Morehouse was all male. But I think my involvement in the student movement was sort of a turning point in my life. It's when I became convinced that I could do something about the problems that I had faced all my life. People like Marion Wright Elliman and John Lewis and others as leaders convinced me that, we can, and we don't have to be violent to do it. And I'd heard the same thing from Martin Luther King Jr. in his pulpit. So I was very fortunate to be here at that time in history and to really begin a journey in which through life, I felt that, I can change things. I can be a part of a movement that changes things. And I really hope that that's a feeling, an attitude that our young people get as they come up, because what I tried to say, we working together can change things. We can be disciplined about it. We can control our own behavior, but also we can support each other. And when I look back at my history, I give a lot of credit to that experience here on the Atlanta University campus, the Morehouse School of Medicine, and to people like John Lewis and Marion Wright Elliman. It's amazing. Most of the people who were involved in the movement as students went into politics. But as you know, from the time that I came to college and much earlier, for me, it was medicine. I was going to be a doctor like Dr. Jackson. But at the same time, I realized that I wouldn't be able to achieve that unless I dealt with something that was really bothering me ever since the cotton fields of Alabama. And that was, how do I fight back? How do you fight back when you don't have the weapons, you don't have the resources? And we found a way. It was a nonviolent, very disciplined approach, and it was working together, supporting each other. And that has been very special in my life.
I think of, Dan, you talk about the determinants and how that, that example, the civil rights movement and how it was addressed some of those political determinants of health, and you just also talked about how in your book we have achieved an inflection point at this moment about equality and equity in healthcare. what do you think are the most important next steps that we can take to ensure that we do not miss this moment?
Yeah, so you heard Dr. Satcher talk about a movement, right?
Mm-hmm.
And I hope that this period that we're in is not just a moment, but it's going to continue to manifest in a movement to elevate health equity that will be sustained moving forward in a manner that's going to positively impact all of these communities that have been disenfranchised over the years. You know, historically, in the few instances in which we did realize some health equity focused policies, their tenure was short-lived. And once opponents of health equity, right, opponents secured power, the political pendulum swung back, you know, to such a degree that it unraveled a lot of the gains that had been made that took years and years to build upon. So in terms of some of the things, the most important steps that we can take, I think, you know, what we're doing right now, engaging in this conversation is important. We have to continue to engage in these conversations, you know, around race, place, and class, and advocate for a full commitment, as you heard me mention earlier, to tackling health inequities upstream in all areas. So we have to go beyond this piecemeal approach, this Band-Aid approach that hasn't really helped to move that needle of health equity very much. I think we also need to recognize that we can no longer just address those more palatable determinants of health. We've got to address the political determinants of health inequities, understanding the levers that have been used, pushed and pulled, right, to concretize these inequities in our communities over time, and understand when they are at play. So we really need to become more educated about, you know, when they're at play. I think another point too is when you think about the communities in which we live, or we are such a transient community or transient society that we move all the time. And I think it's very clear, right, that a lot of us barely remember things that happened a generation ago, much less generations ago. It is so easy to go into a community and judge that community and make, you know, judgments about, you know, whether they're acting responsibly or not. But I think we need to understand, you know, systemically, right, how these past policies and programs at all levels created and perpetuated the inequities in these communities. And I think it's also important, you know, from a policy standpoint, for folks to recognize that exclusion has always been easier to realize than inclusion. Now, there are two other pieces that I would quickly bring up. One is that, and I think Dr. Satcher, in his recount of when he was in the student movement, right, at Morehouse College, and how he, you know, really created that network, right, with his colleagues to create that change that we need. So I think a lot of us, our networks, our engagement has, you know, declined. We need to become more engaged. We need to strengthen our networks. And I think I'm going to go back to that point when you talked about the determinants of determinants, that we have to understand that health equity, if we truly want to realize health equity in this country, it's going to begin and end with the political determinants of health.
Thank you. No, and I also really like what you talked about, needing to know what has gone on before. And that's actually why I thought, Dr. Satcher, your book was really valuable.
Yes.
You know, one of the examples you cite actually in terms of understanding the social determinants of health in your book is what you witnessed following Hurricane Katrina in New Orleans. And I just wanted you to describe to your audience what took place in terms of healthcare access and what you took away from that experience.
Well, to put it in a little bit of a perspective, I had left government after serving as director of the CDC and then Surgeon General and Assistant Secretary for Health. And I had come back to the Morehouse School of Medicine. When Hurricane Katrina took place, NIH and others asked if I would go to New Orleans and be a part of a team to try to begin to rebuild a health system. It was quite an experience. What people went through there, and as you know, almost 2,000 people died in that community. Many people never left their homes, and if you went to their homes, they would have signs up telling you the number of dead people found at that house. That was a kind of experience. And as you know, fortunately, some people who had no transportation, had no way of getting out of their communities safely, died in their homes. It wasn't just that, though. I understand now, of course, that a lot of older people don't want to leave their homes. I mean, if you have to choose between dying in a hurricane and leaving your home to go somewhere that you know nothing about, and we've seen that many times since, there are many people who don't want to leave their homes. So they died there in their homes, and they've had good lives, but they were not that concerned about leaving their homes and starting over. Or they couldn't start over, if you will. Starting over is tough, and part of what we're dealing with here with the determinants of health. And by the way, I was, as Daniel knows, I was fortunate in some ways to serve on the World Health Organization Commission on Social Determinants of Health. And for me, that was quite an experience, going all over the world, looking at social determinants from the standpoint of places like Chile and Brazil, Nigeria, and the way these social determinants, I mean, if you're in Nigeria and you have a community of poor people that don't have running water and are struggling with HIV/AIDS, their struggle is quite different from ours here in Atlanta, for example, or even in New Orleans. So I think your environment and your socioeconomic status, all of those things come into play when you're faced with something like Hurricane Katrina. Now, Hurricane Katrina may be different from COVID-19, and it certainly comes on faster, it hits harder maybe, but in time, COVID-19 hits in the same way in terms of the number of lives lost and the fact that many people are at greater risk. In New Orleans, they were at greater risk because they didn't have transportation out of the area where the hurricane hit. But it may well be that people are in greater risk because they don't have access to health care, or they have diabetes even before COVID-19 hits. So the likelihood that they're going to get the infection and have trouble dealing with it much greater because they start off at a major disadvantage. That's what we found in New Orleans, that many people were at a major disadvantage when the hurricane hit, and therefore were not able to survive it because they didn't have transportation, or they didn't have the health stamina to survive and to move on. It was quite an experience, and I must say New Orleans has come a long way since then, but many of the people who were there, of course, are no longer there. Even if they didn't die in the hurricane, they were not able to return to their homes. And so they may be in Atlanta, or they may be in Dallas, or what have you. It's a very interesting experience to observe.
Thank you. And we actually are getting some questions now. They're appearing in the chat, but also people should feel free to put them into the question and answers. Sarah Locke, who leads our brain health policy team here at AARP, had a question about the best strategies for building the political will to address the root causes of health inequity rather than just the symptoms of poor health. Would anyone want to talk about that? I know that you know, you've talked also about briefly about the connections and the networks that are required and how those are all at risk right now with COVID-19.
Well, I do. I certainly have some thoughts. Dr. Satcher, do you want to go? Or?
Yeah, I want to follow you on this one.
Okay. No pressure, right? So I think for me, what we have seen in terms of the evidence from a policy standpoint, when you look at all of the policies, although I say they've been few and far in between, right? When you look at those policies that we were able to realize, whether it was the Freedmen's Bureau Act from 1865 coming all the way up until today, whether it was the Mental Health Systems Act that President Carter had signed into law right before the 1980 election, whether it was the 1946 bill that President Truman signed to expand or to create the National Institute of Mental Health. When you look at all of these health equity focused policies, and you look at those ones specific to race and ethnicity, never before in the history of this country have we been able to create a federal policy that would just benefit racial and ethnic minorities. They would not allow that. Every single one of these minority health bills, if you will, right? Even from the time of 1990, when Dr. Satcher was talking about Healthy People 2000, but in 1990, when Congressman Stokes and Senator Ted Kennedy and others had worked on this bipartisan bill and got President George H.W. Bush to sign it, even that bill could not, even, and it's called the Disadvantaged Minority Health and Health Improvement Act, even though it was specifically for minorities, they also had to ensure that it would benefit lower socioeconomic status whites. So never ever, I think that's the first lesson we've learned in this country, have we been able to realize a policy that would just solely address the racial inequities, right? And to improve minority health without, of course, including these other groups. But there are also other levers that I think we need to be aware of that have led even to those types of policies, right, that are intended to elevate minority health. They always had to align with a commercial interest and a government investment value. So, you know, yesterday I had the great pleasure of talking with Denise Sisman from Community Care Network of Kansas, Primary Care Association there. We were talking about how, you know, a lot of times we think that that moral argument will suffice, that, you know, we can make the case that thousands of people are dying. And Dr. Satcher did a landmark study showing that, you know, between 1991 and 2000, that with the technological improvements that we'd realized in this country, about 176,000 lives have been saved. But if we had taken an equity lens to that health system work, right, healthcare quality improvement and value-based care and so forth, if we had taken an equity lens, almost 900,000 African-American lives would have been saved during that period. And so I think for us, we have to understand that you can talk about this issue of people dying and getting sick till your tongue bleeds, but that has never resonated with federal lawmakers, with most policymakers in this country. So if you can tie your policy agenda to an economic or national security argument, those are the ones that were always successful in the end. And every single one of these minority health bills that we realized tied it successfully to an economic or national security and a national security argument.
Aligning human interests and commercial interests, and
Yes.
how those are the two pieces that often are fundamental in a successful solution.
That's right.
Dr. Satcher, want to give you a moment as well. And also, you know, one of the questions came up is also, we talk about, and I think it draws about racism as a, you know, as a political or social determinant of health, and you know, and how that has increasingly become elevated, and maybe there's opportunities to address that directly.
I agree. I think racism is a major determinant of health in our society, and there has to be a commitment that we're willing to go beyond race and racism if we're going to eliminate the disparities in health. But racism is certainly a major factor in dealing with it. One chapter, it was difficult for me. Daniel probably could have done a better job with it. It was about science, policy, and practice. And what I tried to do is to integrate the research we do in the laboratory, the things we know scientifically over the years, and then how do we go out and put that in practice? And there obviously are some missing links there. But I do think that our students more and more need to view issues that way. There are questions for science, and we need to know some things that we don't know. And then there are policy issues that we need to work as a team to better understand. Then we need to practice as a team. Here at the Satcher Health Leadership Institute, we've always felt that that in order to provide leadership, which is our major interest, you need to first care enough. We need people who really care about the issues, whether they're in politics or whether they're in medicine or what have you. Then you need to know enough. You've got to know enough to go out and take on the problems. And then finally, you've got to have the courage to do what we face every day. You know, the challenge of knowing enough and doing enough because we care. But without that caring, you know, we can spend a lot of money for people to go to Washington and to work in Washington. And you say, well, we can solve that problem. First, people have to care. They have to care enough to want to solve the problem. And sometimes caring enough means that you're willing to take risk. For example, if you're head of the CDC or FDA and you're dealing with a boss, you know, who gets in the way of your doing your job, it becomes a real issue of, do you care enough? You know, what are you willing to give up? Martin Luther King Jr. used to say that that there are some things for which a person should be willing to die. And he used to say that until you find something for which you're willing to die, you're not fit to live. That was the way he put it. And I certainly think, you know, obviously, but certainly the point of being willing to sacrifice in order to do what you are committed to do, if you're director of the CDC or FDA, there may come a time in which you have to sacrifice your position in order to do what you're committed to doing as head of the agency.
I think with COVID-19, we are realizing that it is what this has done is clarify a lot of people that it is a matter of life and death, with 200,000 in our country alone dying. And I like what you said about caring. You know, Daniel, I want to follow up with this idea of racism and equity as being determinants of health. In a conversation with the American Medical Association's Chief Health Equity Officer, Dr. Aletha Maybank, you offered an insightful comparison between health policy and fishing by a river. And it reminded me of a previous conversation where we've had about the COVID-19 pandemic was described as a rough sea where we're you know, all experiencing, but each of us have different boats, right?
Yep.
And it would be great if you could discuss how fishing by a river fits into your book and the issues that we're facing as a nation.
Yeah, how does fishing fit into this, right? I'm certainly one who likes to use environmental, you know, stories to convey what I think are important life lessons. And so, if you'd permit me, I'd love to tell that story in a minute, right? So the story goes essentially that if you were to envision all of society sitting on the banks of a mighty river, fishing and finding nourishment in the resources that the river provides, the health inequities that we face are represented by the differences in the caliber and the quantity of fish, you know, that we encounter. Some people have a bounty of healthy fish and vegetation to feed off of, while others may only have small fish, no fish or no vegetation, or even malnourished fish, right? Different people having access to different types of resources and different parts of the river, determinants of health. You know, some people are located in a slower moving part of the river by no fault of their own, while others are located in more lush parts of the river and benefit because of such, right? By specific decisions made on their behalf. These I call the political determinants of health. So somewhere upstream, decisions were made to divert the river to benefit certain people and to harm others. And decisions were made to place certain types of people on specific banks of the river while placing others elsewhere. And the idea is that, you know, these upstream decisions have downstream impacts. And it's something that we have to keep in mind throughout the time, because as you think about what has been happening, and I've heard this from a number of folks. I was giving a lecture to law students at St. Louis University, and someone asked the question, well, don't you believe that personal responsibility plays a role? And I said, well, of course it does. We know that, you know, of course, behavioral health and personal responsibilities are also key. But my argument in pushing back is to remind people that when you look at the structural conditions in which people find themselves, it is very difficult in many instances for you to exercise personal responsibility. So if you think about an African-American male, for instance, who wants to go out and exercise and jog, But when you look at all that's going on in this racist society of ours, it really, makes you think about, should I really, is it worth exercising? Because I may not return to my home. If I live in a situation where it's a concrete jungle, right? And ordinance after ordinance prohibits me from creating a community garden so I can, actually have access to fresh fruits and vegetables. I'm trying to be responsible, but again, those political determinants, right, continue to create a chokehold on these very communities, making it really hard to exercise such. So there are a host of variables that we have to think about, and I thought the river would kind of encapsulate that. It's really taking what many of us have heard with other stories of that stream and kind of marrying it with the political determinants.
So thinking about where we are now, that we've had a lot of failures in our fight for equity. But Dr. Satcher, you write in your book about learning from failure can move us to even higher levels of success. So think about where we are now and how we can move to higher levels of success. And you go on to describe in your work in bringing quality care to the Watts community in Los Angeles. Thinking about that, do you think, what can we learn from our failures, the current ones we're having, and how would you adjust our course looking ahead?
So it's a very important point, and I probably can't do as good a job in responding, but I do think that we have to, number one, we have to have a determination that our efforts don't end when we fail. I tell the story in the book about the Meharry struggle, and when some people are old enough to remember, in 1972, when the New York Times had this front page story saying that Meharry was going to close, and like a lot of young leaders, I was the one that people talked into taking on the leadership of Meharry. I wanted to do it, but a lot of people wouldn't have done it given the circumstances that the institution was facing. What I saw was a great institution that had educated half of the Black physicians and dentists in the country and contributed a lot to the care of underserved. And this institution, according to the New York Times, was getting ready to close for financial reasons. And the financial problems were brought about primarily because of taking care of the poor and underserved. So it was clear to me that, we should be able to fight this battle. We have the weapons. And but along the way, of course, our first major attempt resulted in the Board of Hospitals turning down our well thought out requests and plans. And they said no. And I was really despondent. And as I said in the book, when the board came to meet the next week, it just so happened, seemed like the board is always meeting when you least want them to. But they came, and I had decided before they got there that I was going to offer my resignation because I considered this a major failure, that I had been unable to get the board to vote to allow Meharry to have the same access to the city hospital as Vanderbilt, for example. And so when the board met, I told them what had happened, and I told them that I was prepared to step down. And they asked me to leave the room. And while I was gone, they decided that they were going to support me in continuing to lead. So I got back, they said, well, we want you to take this ball to the end zone. Now, you could say, well, you've already tried and you failed, and even though the board is not asking you to leave, you could leave now. But anyway, I didn't. And the rest of the story is that within a year, we were able to get the Board of Hospitals and others to agree for full access to the city hospital for Meharry. And later on, of course, even agreed to rebuild the city hospital on Meharry's campus, which I think is benefiting everybody. I go back to Nashville about once a year, and the working together of Vanderbilt and Meharry and others is better than it's ever been. But it was a struggle. The inflection point, I guess you'd say, was sticking to it, even though I was not totally up to sticking to it. The board said no to me, as opposed to saying, we're going to accept your resignation and move on. They said, we want to move on with you. And as a result, it was very fortunate, but it was failure. It was the failure that led us to that strategy of solution and finally led me to CDC.
That is a great story for the time we find ourselves in now, just knowing that that where we find ourselves today is not where we need to be as long as people care. So
yes.
Thank you. So Daniel, is a series of connection points you also drive home in your book is the link between public participation and the political process and policy. So how do we ensure policies reflect what is happening in our local communities?
Yeah, so I think, we need to start with the idea that beyond voting, it's important. I know immediately we're dealing with this election, and voting is a key political determinant of health, right? As we know, it elects the decision makers. We can use that as a lever to, address or to leverage ballot augmentation, citizen-initiated ballots and the like, right? But beyond that, I think it's so important that we recognize be continuously engaged in this process. It's not just enough to vote, it's not just enough to help even create this policy, but we've got to make sure that it's executed and that within the development and the implementation and the enforcement of these policies, that we are taking that equity lens to the work, right? I think, for too long, and I know Dr. Satcher has encountered this in his career, but even when I was on the Hill on the Senate Health Committee, once we were developing policies, I was shocked how many times, folks would draft a policy, a legislation, and not really think about the impact that it would have on communities of color. And I was also surprised when I would meet with folks from various groups, whether it was the disability groups, the mental health advocates, and others. And I would not see anyone of color within the group. And I thought, well, this is odd. I know folks who have disabilities. I have family members who have diabetes and other chronic issues. So I do think it's so important that that umbrella, right, is stretched to such a degree that it is more inclusive, that we are bringing folks at this policy table so that their voices can also be heard. And I think it's important that we think about those, those lessons that we've also learned in respect to, why haven't we seen as much equity-focused policies? Well, even at the state level, there was I think, a groundbreaking research that was done by a scholar at Boston University, David Jones, who examined, the power that those in minority communities have in Mississippi versus those in other areas, and to look at the bills that passed their legislature, right, over, I think it was in 2017. And what he found was that in that legislature, it was the same groups over and over again who had managed to get their bills done, but those that represented minority communities were the least effective. In fact, I think in that year, there was not even one bill that had passed. So what I have noticed is that we need to think more strategically in helping folks, understand the interdependence, the interconnections that we have, and how what affects us, right, at this level will affect your community as well, those communities that have more power and privilege. So I think it's important to figure out how to do that in a very strategic manner so that we can have more wins when it comes to advancing more equitable policies.
One of the things I've heard that people say is very effective in sort of conveying this, given that, we're all data-driven people here, is actually storytelling, right? Dr. Satcher, a lesson that emerges from your book is the importance of storytelling, both in terms of leadership and health equity. I often think about this issue of storytelling, how it comes to describing for how it helps elevate the contribution of new research and adds to this dialogue of data. Why is storytelling so important and when can we see that and how can we use it to the greatest effect, especially as we talk about, this issue of engaging people and what's happening in local communities, and Daniel, in your book, Fighting Apathy. So, Dr. Satcher, I mean, your book is full of great stories. How do we leverage this issue of storytelling better?
Well, let me make a confession. I love stories. Neither of my parents finished elementary school, but they were great storytellers. And my dad was superintendent of the Sunday school, and he could remember stories from the Bible if he had ever heard them. So I sort of fell in love with stories very early, and I've always been one who, I can remember things if they're related to a story, if they have, life histories associated with them. So I owe that to my parents, I think. Telling helps to bring lessons to life. Mm-hmm. And I know Daniel has in his book some very interesting stories. He's not a farmer, but you would think so when he talks about the farmers. But I think it does. It helps to understand things when you can place it in that kind of context. So I think storytelling sort of shows how things can be possible that you may have encouragement, to hear stories of what other people have been through and what happened. So storytelling, I think, is important in helping to clarify issues and to encourage people.
So since you've mentioned farming in the orchard, Daniel, I would like to give you an opportunity to tell that story. And then this will probably be the last question for you, Daniel, and then switching over to Dr. Satcher. Tell us the orchard story, and then sort of tell us, as you end, how you can paint a picture of a future where you think we've met the goals and techniques you lay out in your books. So if you want to do that first, Daniel, and then we'll let Dr. Satcher end.
Okay, absolutely. So this might come as a surprise to Dr. Satcher. Even though I'm not a farmer, I actually took a test in high school that says my number one career choice should be a farmer. And I come from a long line of farmers, right? So we are one with the earth. But in terms of that story, to Dr. Satcher's point about the efficacy of storytelling, how compelling stories can be, right? And how they tug it. I was in church one weekend, and I was listening to the preacher talk about the parable of the sower. And I thought, oh, this is interesting. Huh. And as he was talking and retelling or recounting that story, I thought, well, I see a lot of coming up, right? And I had just experienced, I had actually flown down to South Florida, where my family lives, my parents, and they were getting ready for Hurricane Irma at the time. And after, Hurricane Irma, there were, trees that were uprooted, there was damage that was done. And a lot of what you read in there comes from actual personal experiences, right? So bringing all of these pieces to bear, I wanted to create a story that, in dealing with a very contentious issue of racism, of health inequities, a very contentious issue for many people. How do I create a story then that will allow me to draw them in long enough and then get to the lesson so that they will stay with this, right? And they will be compelled to do something about it, hopefully. So the idea is this farmer comes, seeking a plot of land because he wants to create an orchard. And he's been looking all day for the perfect spot. Well, he finally comes upon this plot, and he brought with him 6 seeds. But when he finds that perfect plot of land, he sees in the middle of the plot this magnificent tree, right? One that he had never seen before. Branches just twisting and turning far throughout the horizon. And but he just didn't appreciate that tree, and he thought, goodness, that tree is taking up vital space. And so he commences to digging out that tree. And once he dug it out, he decided to put it on the far end of the plot of land, right? Out of sight, out of mind. And then he gets to work now, because now he has a piece of land that he can go ahead and start planting his seed. So in that area where the tree, that mighty tree, right? And he takes 2 seeds out of his pockets. He starts planting, and he takes time to measure the depths of the hole for each seed. He makes sure to add fertilizer to this area and to water them. So he gives it a lot of care. Then he goes, moves a little further out to less fertile soil. It's more sandy soil, and he starts digging more hurriedly because the sun is setting. And he gets there, and as he's digging, he puts them in quickly. He doesn't give it any fertilizer, and he gives them some water, right? And then he looks and he says, "Oh my goodness, all right, you know what? Darkness has befallen us, and I got to get going." So he throws the other 2 seeds on the other part of the plot, which was more rocky, and he leaves them. And then he comes back into spring with his laborers, and they went to look in anticipation what had grown, and to their surprise, there were only 4 seeds that had grown, right? The 2 in that very fertile soil, 1 in the sandy soil, and then another one, very resilient seedling that managed to beat the odds in that rocky soil, all of them growing. And then over time, there was a storm that struck, as you can imagine, Hurricane Irma, right? Or these are the storms of life, the pandemic that has struck us, COVID-19, whether police perpetrated violence or the like. These storms that just come out of nowhere and cause terrible disruption. So it comes in, it splits this tree in half. And now there are 3 trees that are left, right? And the one in the sandy soil still was growing and trying to manage, but there were all sorts of issues that it's dealing with, where the farmer would give fertilizer continuously, right, to these other 2 soils. And he kept looking at them and thinking, oh, these ones are producing, but this one, oh gosh, what is going on? Well, he takes the time to, apply some pesticides. He never really takes the time to go and understand the depth, the root causes of why this tree was struggling. And he just made assumption after assumption. And I know we're running out of time, but the story goes that eventually he loses that tree. And he and his laborers, what they failed to recognize is that if they had put in the right amount of investments and resources, they would have had the orchard that they dreamed would be possible. But instead, they had this graveyard of a scene, right? A horrible, horrible portrayal of what has happened throughout our country in terms of the political determinants of health inequities. And so that is, right with a lot of lessons about equity versus equality, and then brings in that legal and political science lens into the story. So I hope that helps in understanding. But everything has symbolism, which again, I don't have the time to get into, but I urge folks to read it. Yes.
And Dr. Satcher, I want to give you the opportunity to close this. Anything else you'd like to say before we turn it back to our host at Politics and Prose?
Yeah, there's a story in my book that I've rethought from time to time, and I'll just try to make this brief. But you may remember the story where I walked out on a rotation the first day of OBGYN, and there were 4 Black women that were being used for teaching, and I thought they were disrespected. They didn't even have curtains up or anything, and because back in that time, if you didn't have insurance, the only way you could get care was to agree that you were going to be for teaching, and so that's what they did. But anyway, I walked out, and the director of the program told me that that he would see that I was put out of school. Not only this school, which was Case Western, which I love, and I could talk about that a lot. But anyway, the next morning, the dean sent for me, and of course, I was very nervous about why he wanted to see me. I thought maybe this is when I'm going to be put out of school. But when I got there, he told me that the other students, 9 other students on the rotation, had walked out also that morning. And So there are two lessons in that, and I misread the first one at first. The real lesson is leadership is not just about your willingness to act yourself, but your ability to get others to act. And if I had taken the time to talk with the other students, it may well be that I would not have been put at risk. So over the years, I reinterpreted that story, and I don't look so good in it, the way I reinterpret it, but it's important for young people to know that we live in a world where you can't assume that you're the only one who's sensitive to certain things. So you've got to give other people a chance, to react. I don't know if that makes sense, but that's the best I can do with the short time.
No, that is so key for this moment. The importance of networks and what we have to do to find a better way to equality. Thank you.
Well, thank you all so much. I was really moved by this event today, and I want to thank you all for your time and for sharing your stories and your wisdom and expertise. Dr. Tan, I know you had one more thing you wanted to mention that AARP is working on or offering in the future. Is that, I don't want to put you on the spot, but is that
Yeah,
right?
no, next week on the 7th and 8th, we're going to be having a conversation about health and equity, and we'll send you, we can send folks more information, but it's going to be specifically also about a report we're releasing with IHME looking at disparities in geography and life expectancy, and looking at Black residents and how from 1980 to 2014, we have had growing inequity that I think has led to what we see today. So I think we are very much committed to this continued conversation, and we appreciate what Politics and Prose has done and the two great leaders who we've had here today.
If you'd like to put the link to register in that chat, Dr. Tan, I'm sure everyone would appreciate seeing that. Thank you, Dr. Satcher. Thank you, Daniel Dawes. This was just incredible. I also want to thank your publisher, Johns Hopkins University Press, the publisher of both of your books. And thank you so much to our audience. Thank you for caring. I read in the chat that a lot of you are healthcare providers and on the front lines and are working in the health policy world as well. So I'm so glad you could join us. And thank you for the work that you're all doing. So with that, I'll sign us off. I'll hope that everyone stays well, be well, and stay well read.